Assalamu alaikum. My name is Ayun Fatima. I am from Sialkot. I am currently student of UMT. Currently, I am studying in UMT, the University of Management and Technology. I am student of BS Chemistry, and today my presentation topic is acetylcholine. Here is the content of my presentation. First, introduction, then formula, then structure, history of discovery of ACH, then synthesis and release of ACH, then mechanism of action of ACH, then sites and functions of ACH, then we will discuss the applications of ACH. So here we discuss the introduction. Acetylcholine is an organic compound chemical that function in brains and many other animal bodies like humans and many other animals as a neurotransmitter, a chemical released by nerve cells to send signals to other cells. Its name is derived from its chemical structure. It is an ester of acetic acid and choline. Parts in the body that use are affected by acetylcholine are referred to as cholinergic. Acetylcholine is a neurotransmitter used at the neuromuscular junction. In other words, it is a chemical that motor neuron of the nervous system release in order to activate the muscles. Here is a term the neuromuscular junction NMG. It is a synaptic connection between the terminal end of a motor nerve and the muscles. It is a source for the transmission of action potential from nerve to the muscles. So acetylcholine is also used as a neurotransmitter in ANS and CNS both. Both as a internal transmitter for the sympathetic nervous system and as a final product released by the parasympathetic nervous system. Here is second structure and formula of acetylcholine. Formula of acetylcholine is here C7NH16O2 plus. Then structure, and here is your structure. Here the acetylcholine structure is front of you. Acetylcholine is an ester of acetic acid and choline which act as a neurotransmitter. It has a role as a vasodilator agent. A vasodilator agent is basically a medicines that open, also called dilate blood vessels. They prevent the muscles from tightening. It is also used as a muscarinic, agonist, a hormone, a human metabolite, a mouse metabolite, and a neurotransmitter. So it has a huge vital role in human body and is used in a wide range. It is basically the neurotransmitter in brain. It has many applications in our memory system. Here is history. Acetylcholine are first identified in 1915 by Henry Hallett Dale for its action on human tissue. It was confirmed as a neurotransmitter by Otto Loewi, who initially gave it the name vagus stop because it was released from the vagus nerve. Vagus nerve is main nerve of your parasympathetic nervous system. So he received Nobel Prize in Physiology or Medicine for their work in 1936. Acetylcholine was first developed as a neurotransmitter. Here is synthesis and release. Synthesis and release of acetylcholine in certain neurons by the enzyme choline acetyltransferase. Acetyltransferase is an enzyme from the compound choline and acetyl-CoA. Cholinergic, it is basically the neuron on which acetylcholine work. It is on the neuron which acetylcholine work are called cholinergic neurons are capable of producing ACH. At least half of the choline used in ACH synthesis is thought to come directly from the cycling of release of ACH. Then presumably uptake of this metabolically derived choline occurs rapidly before the choline diffuses away from the synaptic cleft. Another source of choline is a breakdown of phosphatidycholine, which may be stimulated by locally release of ACH. Choline derived from these two resources, which come available in extracellular space and is then subjected to high affinity uptake into the nervous ending. Here is mechanism of action. Like many other biologically active substances, acetylcholine exerts its effect by binding to an activating receptor located on the surface of cell. These are there are two main classes of acetylcholine receptor, nicotinic and muscarinic. They are named for chemicals that can selectively activate each type of receptor without and activating the others. Type 1, nicotinic acetylcholine. Nicotinic acetylcholine ligate ion channel permeable of different chemicals like sodium, potassium and calcium ion. In other words, they are ion channels embedded in cell membrane capable of switching from closed site to open site. When acetylcholine bind to them in the open state, they allow ion to pass and go to closed state. Nicotinic receptor come in two main types known as muscle type and neuronal type. The muscle type can be selectively blocked by a courier and the neuronal type by hexamethymium. The main location of muscle type receptor is on muscles as described in the below, and neural type are located in both sympathetic and parasympathetic means CNS and PNS. Here is second type, muscarinic acetylcholine receptor. It is the type which is more complex than the first type, and it has more complex mechanism than the other. The effect targets cell over a longer time frame. In mammal, there are 5 subtypes of muscarinic receptor have been identified, labeled from M1 to M5. Through all of them function as G protein coupled receptor, meaning that they exert their effect via second messenger system. The M1, M3 and M5 subtype are GQ coupled. They increase the intracellular level of IP3 and calcium by activating phospholipase C. Their effect on target cell is usually excitatory. The M2 and M4 subtype are GI and GO coupled. They increase the intracellular level of CAMP by the enzyme adenylate cyclase. It is basically an enzyme used for this process. Their effect on target cell is usually inhibitory. Muscarinic acetylcholine receptor are found in both the CNS and PNS, means central nervous system, and the peripheral nervous system of the heart, lungs, upper gastrointestinal tract and sweat glands. Then the sites and functions of ACH. Neuromuscular junction. Muscles contract when they receive signal from motor neurons. The neuromuscular junction is a site of the signal exchange. The step of this process is vertebrates occur as follow 5 to 6 steps. The first step is the action potential reach the axon terminal. Then the calcium ions flow into the axon terminal. Then acetylcholine is released into the synaptic cleft, and then acetylcholine bind to phosphosynaptic receptor. Then number 5 is this binding cause ion channel to open and allow ions to flow into the muscle cell. Then last step, the flow of sodium ion across the membrane into the muscle cell generate an action potential which induce muscle contraction. Acetylcholine is a substance the nerve system usually use to activate the muscles, to activate the skeleton muscles, a kind of striated muscles. They are the muscles used for all type of voluntary movement in contrast to smooth muscle tissue which is involved in a range of involuntary activities such as movement of foot through the large tract and constriction of blood vessels. Skeletal muscles are directly controlled by motor neurons located in the spinal cord, and in few cases the brainstem. The motor neurons send their axons through motor nerves from which they emerge to connect the muscles fiber at a special type of synapse called the neuromuscular junction. When the motor neuron generates an action potential, it travels rapidly along the nerves until it reaches the neuromuscular junction, where it initiates an electrochemical process that causes acetylcholine to be released into the space between the presynaptic terminals and the muscle fibers. So the action acetyl molecule then bind to nicotinic ions channel receptors on the muscle cell's membrane, causing the ion channel to open. Calcium ions then flow into the muscle cells, initiate a sequence of steps that final product muscles contract. Second is autonomic nervous system, ANS. The autonomic nervous system control a wide range of involuntary and unconscious body function. The main branch are its main branch are the sympathetic nervous system and parasympathetic nervous system. Broadly speaking, the function of the sympathetic nervous system is to mobilize the body for action. This slogan often used for it is fight or flight. The function of the parasympathetic nervous system is to put the body in a state conducive to rest, regeneration, digestion, and reproduction. It is sometimes described using the slogans rest and digest or feed and breed. Both branches use acetylcholine for their functions, but in other ways. As a schematic level, this sympathetic and parasympathetic nervous system both are organized in essentially the same way. Preganglionic neurons in the central nervous system send projection to neurons located in autonomic ganglia. These neurons then send output projection to virtually every tissues of the body. In both branches, the internal connection, the projection from the CNS to autonomic ganglia use as acetylcholine as a neurotransmitter. They use the neurotransmitter of acetylcholine for their function, and the receptor it activates are the nicotinic type. In the parasympathetic nervous system, the output connection, the projection from ganglion neurons to tissues that don't belong to the nervous system, also release acetylcholine action on muscarinic receptor. In sympathetic nervous system, the output connection mainly released norad. It is the enzyme name noradrenaline. Although acetylcholine is released at the few points such as the pseudomotor innervation of the sweat gland. Is a direct vascular effect. Acetylcholine is a serum exert a direct vascular effect by binding to muscarinic receptor present on vascular endothelium. These cells respond by increasing production of nitric oxide, which signal the surrounding smooth muscles to relax and leading to vasodilation. As I explained, vasodilator are the muscles that prevent the muscles from tightening, are the chemical that prevent the muscles from tightening, and it relax them muscles. Memory. Acetylcholine has a great role in memory in several ways. Acetylcholine has been implemented in learning and memory in several ways. The anticholinergic drugs scopolamine impairs the formation of humans and animals and different type of animals. Disruption of the supply of acetylcholine to the neocortex impaired the learning of simple discrimination tasks comparable to the acquisition of factual information and description of the supply of acetylcholine to the hippocampus and adjacent cortical areas produce forgetting comparable to anterograde amnesia in humans. Clinical correlation. Myasthenia gravis is an autoimmune disease that is characterized by muscle weakness and fatigue. Is B cell mediated and is associated with antibodies directed against the acetylcholine receptor. Muscle specified kinase lipoprotein related protein or origin in the postsynaptic membrane at the neuro. So basically it is used in this disease and its treatment used by acetylcholine. Patient with myasthenia gravis should be classified into subgroup to help with the therapeutic decisions and prognosis. Subgroup based on serum antibodies and clinical features included early onset, late onset, thermoma, MUSK, and many other antibodies, negative and ocular form of myasthenia gravis. Here is also its process by which it is used in this treatment and in which all the treatment acetylcholine plays important role in making the drugs. So also there is a new disease Alzheimer, which we all know, also referred to simple as Alzheimer, is a chronic neurodegenerative disease that usually starts slowly and worsens over time. It is the cause of 60 to 70% of cases of dementia. The most common early symptom is difficulty in remembering recent events like short memory term. So as the disease advances, the symptoms included problems with language, disorientation, including easy getting lost, mood swings, loss of motivation, not managing self-care, and behavioral issues. So a person condition decline, they often withdraw from family and society. Gradually bodily function are lost, ultimately leading to death. Although the speed of progression can vary, the average life expectancy following diagnosis is 3 to 9 years. Causes. Genetic cholinergic hypothesis is the oldest on which most currently available drugs therapeutic are based. It is the It is basically cholinergic hypothesis, which proposed that AD is caused by is caused by reproduced synthesis of neurotransmitter acetylcholine. The cholinergic hypothesis has not maintained widespread support, largely because medication intended to treat acetylcholine deficiency have not been very effective. Number 9, it has many applications on pharmacology, and acetylcholine is huge vital use in making drugs for humans which are treated to disease and which are best for humans. So pharmacology: blocking, hindering, or mimicking the function of acetylcholine has many uses in medicines. Drug action on the acetylcholine system are either agonist to the receptor stimulating the system or antagonist inhibiting it. Acetylcholine receptor agonist and antagonist can either have effect directly on the receptor or exert their effect indirectly, which means it had direct effect and indirect effect. Affecting the enzymes acetylcholine trace, it is the enzyme which is used for the treatment of diseases, which degraded the receptor ligand. Agonists increase the level of receptor activation, antagonists reduce it. Basically, it has the opposite work of both these, antagonist and agonist. Examples of drug agonists which are used to the drugs direct acting agonists are acting directly or cholineceptors actually. So pilocarpine is a cholinergic drug, that is a drug that mimics the effect of chemical acetylcholine which is produced by nerve cell. Pilocarpine eye drop have been used for many years to treat glaucoma, a condition in which pressure within the fluid of the eyes is abnormally elevated and ultimately damage the eyes and impair vision. In 1994, an oral formulation of pilocarpine was approved by FDA for the treatment of dry mouth caused by radiation therapy for head and neck cancer, a treatment that damages the salivary gland and produces their production of saliva. In 1998, the oral preparation was approved for the management of a disease syndrome Sjogren's, an autoimmune disease that damages the salivary and lacrimal glands. Dose of this oral pilocarpine usually is taken 3 to 4 times daily. The recommendation dose for radiation induced xerostomia is 5 to 10 mg 3 times daily. So it basically take 3 times. It basically taken in a time 3 times in a day. Side effect: dizziness, vomiting, flushing, and diarrhea. Second, indirectly acting agonist, acting indirectly by inhibiting the activity of enzyme responsible for de- de- degradation of ACH. So neostigmin, competitive inhibitor of choline trace, it is enzyme also, resulting in decreased hydrolysis of acetylcholine by cholinesterase. By reducing the breakdown of acetylcholine, neostigmine increase acetylcholine in the synaptic cleft, which compete for the same binding sites as non-depolarizing neuromuscular blocking agent and reverse the neuromuscular blockade. Mainly, it is used for symptomatic treatment of myasthenia gravis. Its dose is usually depending on medication condition and response to therapy. Side effects: vomiting, diarrhea, abdominal cramp means lower abdominal pain, increase saliva, mucus, decrease pupil size, increase urination, or increase sweating may occur. Side effect can also reduce by drinking milk. So same action of neostigmine but with longer duration of action, and is used for chronic management of myasthenia gravis. So here is third, endophonium has very short duration of action and used for diagnosis of myasthenia gravis. Antagonist class of medication known as anticholinergic or antimuscarinics. Entropin occurs naturally and is extracted from the belladonna alkaloid plant. Entropin Atropine work by blocking the action of chemical called acetylcholine. Atropine has numerous uses in clinical medicine and is available in several dosage forms, including oral tablets, which are 0.4 mg, and solution of for injections, ophthalmic solutions, and ophthalmic ointments. So its side effect is here is the bottle size of it. So its side effects may cause drowsiness, dizziness, or blurred vision. Cause caution when operating machinery or performing other hazardous activities. Here is its another application in botulinum toxin. Botulinum toxin is a neurotoxic protein produced by the bacterium Clostridium botulinum and related species. It prevents the release of the neurotransmitter acetylcholine from axon ending at a neuromuscular junction and thus cause flaccid paralyzed. Injection with the bacterium causes the disease botulism, means botulism. The toxin is also used commercially in medicine, cosmetic, and research. Medical use of BTX: focal dystonias, involuntary, sustained, or spasmodic patterned muscular activity. Cervical dystonia is spasmodic torticollis actually. So here is different uses of this. All the uses BTX. Second is spasticity, means velocity dependent increase in muscle tone, and its treatment is brain surgery, cerebral palsy, and multiple sclerosis. Number third is non-dystonic disorders of involuntary muscle activities. Here is its uses. And fourth is chronic pain and disorder of localized muscle spasms, localized muscle spasms. And here are fifth, smooth muscles hyperactive disorders. And there are some adverse effect event. Adverse event due to the therapeutic and cosmetic injection of Bond reported to FDA included respiratory problems, dysphagia, seizure, flu-like syndrome, facial and other muscle weakness, ptosis. So here are different side effects. Also, acetylcholine has many applications such as acetylcholine are intervenes in numerous physiological functions such as regulating cardiac contraction and blood pressure, intestinal and glandular secretion, etc. Typically, acetylcholine is an excitatory medicator. Here is the last summary of our whole topic. So, acetylcholine is a neurotransmitter that transmits signals from one neuron to another or from neuron to muscles to produce action potential. Then, ACH was first neurotransmitter to identify, and its old name is vagus stuff. So, first time its name is vagus stuff, then its name was identified as neurotransmitter. This type of receptor that ACH act on is cholineceptors, means muscarinic and nicotinic. ACH is synthesized by axon terminal by ACH transferase enzyme and hydrolyzed by choline enterase. It is also enzyme and both are present in neuron terminal. Here is ACH is a substance of nervous system that activates skeletal muscle. Myasthenia gravis is a popular autoimmune disease occurred due to antibodies directed against ACH receptor and cause muscle weakness and many other symptoms. Alzheimer's disease is very popular age-related neurodegenerative disease, cause loss of recent memories and reorientation and loss of motivation. It related also to deficiency in ACH. Blocking or mimicking the action of ACH have many uses in medicine. Drugs that acting on ACH receptor, either agonist or antagonist. Blocking the release of ACH at neuromuscular junction by botulinum toxin. Botulinum toxin, BTX short form, have a wide range of uses in medicine, especially in plastic surgery and many others. So here is the top. So here is my topic, acetylcholine, and hope that it will help you. Allah Hafiz.